Welcome back to the Arise interview. I'm Charles Anyegolu. Now, as Omicron becomes the most dominant variant in the world, one place where coronavirus cases are rising fast is here in Nigeria. On Monday, the country's Centre for Disease Control said there'd been a rise of 500% in cases caused by the Delta and Omicron variants in the past couple of weeks. As part of its statement, the health authority said to please avoid all non-essential travel within and outside Nigeria to reduce the risk of transmission, and for people to get vaccinated and boosted to avoid a difficult few months ahead. It comes as one of Nigeria's top entrepreneurs, Titus, founder of Stanbic IBTC Bank and president and founder of the ANAP Foundation, confirmed an outbreak of COVID in his home and that he himself had tested positive. Well, for his analysis of the latest warning from the Nigerian Centre for Disease Control about rising COVID cases in the country, I'm joined now by the surgeon and public health specialist, Professor Titus Ibekwe. Thank you very much indeed, Professor, for coming in. Busy time for you, so we appreciate your making out the time to come and help us understand what's happening and also to educate the public. In your area of work, I mean, you're a surgeon, but you're also a public health specialist. Are you seeing a dramatic rise in COVID cases and exponential growth of people who are symptomatic?
Thank you very much, Charles, for having me. We're all witnesses to the latest release by NCDC, which is evidence-based. But looking at our environment, even without scientifically going into research work, anecdotal evidence is highly supportive of this. You see a lot of people getting sick, coughing, and presenting with symptoms. We know that Omicron itself, there are some typical features of they call it the traditional COVID-19 that are lacking, such as loss of smell and taste, which is usually the red flag. But coming back to our various hospitals, I can tell you that the rate of positive testing are on the rise. And one typical feature which Omicron is associated with is high level of infectivity and transmissibility, which means ability to be passed from one person to the other is extremely high when you compare to even the Delta variant, the Alpha, and others that we have known. But the only good thing here is that, again, evidence has shown that mainly mild diseases that we have here, because the mortality rates cannot be compared so far with what is available. And cluster of cases from South Africa, which was the very first place that this was actually first isolated, also show that they are mainly mild diseases. So I'll go with NCDC that actually there's rise. What we're having is not likely due to just the weather.
Right.
Yeah.
Well, thank you very much indeed for that analysis. And is it your sense that this is likely to be because of Omicron? Because I understand the Nigerian scientists and medical sort of staff are yet to sequence the new set of samples they've collected.
Yeah, no, but NCDC has done. They have sequenced some and came out
which
with
is what made
positive
them
cases. Yeah, which was why the red alert was raised, and even the first two cases that were recorded in Ontario, Canada, had Nigerian travel history. You know, and subsequently some were confirmed here in Nigeria, because actually you don't need all that sophisticated tools. What should be able to, identify the previous variant has the ability, only that the particular protein, the S protein, that you'll be seen missing when you do the sequencing using the conventional PCR. So that will also tell you that it's indicative of the Omicron. So the reality is Omicron is here, but if you look very deeply, I can assure us there is a mix here. We know that Harmattan have a lot of very dry breeze here and there, which should be even a vehicle that help in further propagation, because this is
yeah, that's a good point.
Yeah, this is mainly we know that it has to do with also airborne and droplets. So these fast traveling winds and dry weather will assist in propagating this from one place to the other for those who cough and all those. So and since it has been proven that this is highly infective, so you expect cases to be on the rise, even more at this particular time of the year.
But as you mentioned, because it's Harmattan, you've got a greater occurrence of things like, colds and flus and, fevers and that sort of thing, and also just allergies, I guess, because of dust in the air and so on.
Absolutely right. What you have said is very correct. I'm primarily an ENT surgeon, and this is our domain. So within these periods, you have a lot of particulates, including allergens, within the air, which exacerbates even those who are atopic patients and make their situation worse. Those hitherto who are not atopic, that's predisposed to having allergy, also have more upper respiratory tract infection within this period. And affectation generally, even the skin has its own fascia, and it also desiccates the system. Those who have renal challenges, this is the period that they may even come down the more.
Right.
And that's why people are advised to hydrate more than they used to. So everything is out there that is very much in support of further propagation of this disease.
Now, one issue, of course, is vaccination and the prevalence of that within Nigeria as a form of protection. Are enough Nigerians getting vaccinated right now?
No, the information is out there in the public domain. We're talking of nothing more than 2% or thereabout Nigerians that have been fully vaccinated. But the disturbing thing is that we still have batches of this vaccine waiting out there to be consumed, and people are not coming forward to have them. Even people being encouraged to have booster doses, which is an area that we need to do more. Because in order to increase uptake in vaccine consumption within a population, there are certain critical factors that must be improved upon. One is availability of the vaccine itself, which presently is not really the problem, because there's even insinuation that some on the shelf may expire very soon if
because nobody's taking them.
If they're not used, which is one. Then the other factor is the issue of information sharing, and sharing it in the right proportion, in the right manner, and in the right direction.
Right.
It's not enough to concentrate on just television and
you need to disseminate more information.
Down to the.
But when the CDC says, please, avoid all non-essential travel within and outside Nigeria during this Christmas period, is that sort of warning likely to be heeded? I mean, Christmas is often a time when people head off to see their families in this country, isn't it?
Well, for the very intelligent ones, will not want to be used as guinea pigs. So it is life first. You need to live to celebrate many more Christmas ahead, But the issue here is that it cannot work through coercion. That's why I was talking of the mannerism of this information sharing. Ability to take this message down to the hinterlands using people who are trusted by people in these hard-to-reach areas to propagate the information, so that they will embrace it and even come forward to have the vaccine voluntarily, rather than just putting up the information out there. So we really need to do more. And very importantly is the issue of debunking falsehood, which is making the rounds.
We're going to have to leave it there, but I want to thank you very much indeed. Very, very interesting talking with you. Professor Titus Ibekwe is a surgeon and public health specialist.